Most doctors I work with make their marketing more difficult than it needs to be because they think their patients are unique. When in reality, your patients aren't unique. They're just like everyone else because they're human beings. And human beings only care about two things: their emotions and whys. When you frame your surgeries, treatments, and products through these emotions and whys, you're going to create marketing that's unforgettable and cannot be ignored by the patients you want to help. In this video, I'm going to walk you through all the emotions and whys you need to focus on in your marketing, and then I'm going to do a writing workshop where I share some examples on specific surgeries. The first thing we're going to talk about, I'm just going to go through these one by one, is emotions. Emotions, the only emotions you need to focus on is greed, a great deal, sex, love, and intimacy, and those are three very different things. Sex, love, and intimacy are not the same thing. They may sound like the same thing, but they're very different. To be loved is a lot different than wanting to have sex. Health, self-improvement, fear, respect, pleasure, and comfort. Those are the emotions that you must frame all of your surgeries, treatments, and products through. Next is the whys. They're whys. Make and or save money, save time, avoid effort, escape mental and or physical pain, get more comfort, achieve better health, gain praise, feel more loved, increase popularity. Feel more loved, for example, and it's just top of mind because I was talking about it with someone, there's a lot of different layers in that. Feeling loved versus being lusted after, those are feelings that your surgeries, treatments, and products can give someone. Now, there's a lot of overlap to these, and I'm going to sound like I'm repeating myself, increase popularity, because I am repeating myself, because the motives of human beings are all the same. It doesn't matter if you're someone that is going to a plastic surgeon, it doesn't matter if you're someone that's going to an orthopedic surgeon, it doesn't matter if you're someone that's going to a dentist. Any doctor, at the root of all of it, at the root of health, is self-worth. So when you talk to these things, you're talking to their self-worth as a human being. Now, I got specific on these, like mommy makeovers and these different things that I went through, but there's not a lot of difference when you really think about it. All of their emotions and whys are the same. So you really need to focus on these emotions and whys when you're crafting all your marketing. So I want you to get out a piece of paper. So first of all, I want you to think of what's the surgery, treatment, product, whatever you have, that's your number one favorite thing to perform. Specific. So I just recently talked with a client of mine. It's top of mind. I'll use that one. Let's say and the first thing you're going to write this is your piece of paper. The first thing that you're going to write is, who are you talking to? Let's just say I'm talking to Fiona. Fiona is my avatar. And you want to get really specific on this. Let's say Fiona is 55 years old and has 2 kids and is obviously a wife. So there you go. That's Fiona. That's the patient that you have that you want to talk to. This is my patient. This is my fictional patient. Now let's say Fiona wants a facelift. That is how you can help her. You have your avatar, you have the patient that you want to help, the patient you have helped, and the patient that you want to attract with your marketing, and then you have your surgery here, which is a facelift. Now what I want you to do is I want you to just draw another line here, cut this down, and I want you to do emotions and whys. And in the interest of time, I'm not going to go through all these, but I want you to write out every single emotion. I'm going to put them in the caption of this video, and if you're seeing this on my website, there'll be a breakdown of it below. All the emotions and all the whys, and I want you to really think and get in detail with these. And like I said, I'm not going to go through these right now. I have other videos where I've done it. There's going to be more written about this below this video. You'll see it. But I want you to go in detail of every single emotion and attach how this helped her achieve that. The before and the after. The state of mind and the physical state that she was in before, the state of mind and physical state that she was after. So what you can even do to even split it up further is you can say before, after, before, after. And that's it. So once you have all that together, and it doesn't need to be pretty, it can just be like I do, I write bullets. So you just write bullets. 2 to 3 sentence, 2 to 3 sentence, 2 to 3 sentence, subparagraph, subparagraph, subparagraph. Then we're going to all put that together. The way that you put that together after is you go back to the formulas that we had before. So at the very end, your formula is you're going to have the if, then, how, before, after, path. That is how you write an unforgettable piece of marketing. You're going to talk to a very specific person. This can be someone that you create. It could be, one thing that I recommend is print out a photo of someone and put it up in your writing space. That's what I do, and that's what I do for all my clients. Know a lot about them. This is called a psychographic. Then, what is the specific thing? This is a specific surgery. Then the emotions and whys attached to it. Before, after, and then the formula that I did before. Now I'm going to do a writing workshop. This is just a couple samples that I went through that I think will give you a little bit more context. I'm not going to go through all of them in detail because I want to do, in the interest of time, want to get specific. But these are a couple examples that I recently went through with a client of mine. For example, number one, a breast augmentation for a 35-year-old woman. This is a plastic surgeon client of mine. Now, what are the emotions? One emotion that I worked off of was a great deal. And a deal is not like, oh, you're the cheapest one. It's an investment. It's a higher perceived value. You're not talking about this is how much it costs. This is a lifelong investment in your body and your self-confidence. She's aware of the investment, but she wants to feel like she's getting the most value for her money. The key word, value. It's not a cost. There's value. It's an investment. It's a higher perceived or a higher perception of that. Knowing the long-lasting effects of breast augmentation, she sees it as a decision that will benefit her for years to come. If we're talking straight dollars and cents, what is the cost of this surgery versus what is the financial benefit and the financial impact of being a more confident, radiant person? Next, sex, love, intimacy. She's looking to enhance her self-confidence and feel more attractive in her intimate relationships. Breast augmentation can help her feel more desirable and at ease with her body. Fear. She's hesitant about the surgery. This is a lot of different things. This is where I call this kind of like the net of where the patient is at. Everything they're going through, they're going to be fearful. It's fearful excitement. They're excited to see what the outcome's going to be and all these other benefits that they would get from it, but they're also fearful. So that's where, and I go through this in a bunch of other videos, I'm not going to get in it now, you're going to create clarity and you're going to walk them through the whole process. Next, pleasure. She's looking forward to the joy of wearing clothes she's always dreamed of wearing and feeling beautiful in her own skin. The idea of enjoying her new body brings her happiness. In your marketing, say something like, how many times have you walked through the mall and saw an amazing outfit or a stunning outfit and thought, I wish I could wear something like that? That type of emotion is what they're thinking about, and that's what you need to channel in your marketing. And next, comfort. The procedure will help her feel more comfortable in her day-to-day life, whether that's in how clothes fit or how she feels about herself when looking in the mirror. This is the ultimate of all ultimates that you're helping your patients with. Peace of mind, comfort, really enjoying their life. The next one that I have, I won't flip over the page, but the next one that I have is the whys. Escape mental, physical pain. Every day she experiences the mental pain of feeling less confident in her body. The surgery offers a solution to the emotional discomfort she feels. Again, peace of mind. I look at, anytime I do my marketing for my clients, which starts as a written piece like this, like a written workshop or a written group of notes like this, I always list out all these different things. And one of the things that I have is I like to do both sides of it. The benefit that she's going to get, but also where she's at right now. So the dream outcome, but also the nightmare that she's in right now. So you're going to talk to escape mental, physical pain, but also the outcome. So it's the positive and the negative. The negative is where the patient's at right now. The positive is where you can get them. Next, achieve better health. While cosmetic, the surgery helps her mental health by boosting her self-esteem and helping her feel good about her body's appearance. And lastly, the last one I had down here was increased popularity. With her newfound confidence, she'll feel more comfortable in social settings, and that could translate to deeper relationships and social connections. Absolutely true. Increased popularity. Everybody wants to be popular. And popular doesn't mean I'm known by 10,000 people. It may be in my little circle that I'm no longer going to be not outgoing because I'm self-conscious. All these different things you can weave together into a story by using an example of patients that you've helped. That's compelling marketing. The next one that I have is a facelift for a 53-year-old professional woman. Number one, a great deal. That goes back to what I said on the last thing. You can sell that your products are a great deal. It's not price, it's value. It's an investment in their self-confidence. Imagine what your life will be like 6 months from now, a year from now, 3 years, 5 years, 10 years from now when you've made this investment in yourself and you're fully confident in yourself in every social setting, at work. This is a professional woman. What if you're more outgoing, like in meetings and stuff? These are all benefits that give them a great deal. The value that you're giving them with your surgeries, treatments, products should so far outweigh whatever the actual dollar cost is that it shouldn't even be a consideration how much it costs. They should be like, this is an investment. And that's the language that we should be using, is investment, value, benefits. It's not a specific cost. Next thing is self-improvement. She's always worked on self-improvement, and this is another way to feel her best as she ages. This is a part of her health routine. Next, fear. Her biggest fear is obviously the surgery, like I mentioned in the last one, but her biggest fear is losing her youthful appearance and the opportunities that come with it, both personally and professionally. In the back of her mind, she's worried that, am I going to be taken as serious as I should be, as I know I should be, just because I'm getting older. This is normal for everyone. And I know this is uncomfortable to say, it's uncomfortable to live through. When you talk through this through the lens of the patients you've helped, I've been a lot more outgoing. I've been less fearful. I've been less fearful that people are judging me. I'm more confident. It radiates out of me. These are higher value things than just kind of like the X's and O's of the specific surgery. And lastly, comfort. The facelift will help her feel more comfortable with the aging process, as she'll have more control over how she looks. I've said this in a bunch of other my content. I think really what comes down to fear is control. And I think that you own a private practice because you started that private practice because you wanted control. You wanted that autonomy. I think the biggest fear, and on the other end of fear is comfort, that people have is, I just can't control it. I'm aging, there's nothing I can do. I buy creams, I do this, I do that. I take care of myself, I try to do the best I can. But you and I know there's certain things that are just out of their control. This gives them peace of mind, of comfort, of controlling how they age. Next, the whys for the facelift. And I'll just flip this over just so we have it for reference here. Random, avoid effort. Rather than trying multiple treatments to stay youthful, the facelift provides her with the results she wants in one procedure. Again, not piecemealing things together. This is a comprehensive solution to a problem that they have. A comprehensive outcome. You come in, we help you, you're done. That's it. You don't have to worry about all this stuff. The other thing about avoid effort is when you look at some of the most premium brands, the very most premium things, the thing that they offer the most, like, and I use that word comprehensive, is the premium experience is it's as seamless and stressless as possible. So just that thing of saying, hey, you could come in and within a couple hours, you don't have to do anything else. This is a one-stop destination and you don't have to do all these other things. So again, I'm being a little direct. We wouldn't be this way in the marketing. It would be a little bit more fluid about this. But what I would lean on is I would say the opposite of, like going back to what I said earlier, the opposite of avoiding effort, maximum effort. My patients have done X, Y, Z. They spent all this money. They tried all these things and they didn't really get any results. It frustrated them. It was a ton of money. But if you want to avoid all that effort and get this outcome, here's how we can do it here with the facelift. Next, I'll just randomly do gain praise. She anticipates compliments from colleagues and friends, helping her feel validated in her decision. Next, increase popularity. With a refreshed look, she feels more confident in social and professional circles, helping her maintain and build relationships. It's kind of like this thing now where people are like negative about everything. Where they're like, oh, I don't want to be popular. I don't care about that. Everybody wants to be popular. Even if it's popular in your community of friends, or if it's in a meeting, or if it's in a networking event, whatever it may be, it comes back to your self-worth. Everybody has self-worth. Anyone who tells you I don't care about being popular is wrong. They want to feel seen, accepted, and popular inside their community. Now this, like I said, it doesn't mean it's 10,000 people, you have 1 million followers, whatever it may be, all that vanity stuff. What it comes down to is being popular, being cared about in their community that they're in. The next one that I have is a mommy makeover for a 43-year-old mom after she's had 3 kids. Very specific. That's the avatar that I went off of for this one. Let's just sample health. The combination of liposuction and a tummy tuck will not only give her a more balanced, proportional body, but will also help her align her appearance with the healthy lifestyle she leads. This talks to, and I just had this conversation with a client of mine, this talks to, I exercise, I eat healthy, I do all these things, I just can't, I just feel defeated. It hasn't made an impact on my body. There's certain things health-wise that you just can't do on your own. It was a huge change on your body. And the thing that we talked about was, through that was a tummy tuck. You know, the body goes through a lot. You cannot will yourself through exercise, diet, and stuff to reverse that. And this talks to that. This is an alternate angle of health. Like you're doing diet, you're doing exercise, you're maintaining a healthy lifestyle. There's certain things that are just unfortunately out of your control at this point. Here's how we can help you. Next, let's do fear. She's afraid that without these procedures, she'll continue to struggle with body image issues despite all her efforts. The fear of continuing to feel disconnected from her body motivates her to take this step. Fear is maybe not even the fear of the surgery. A lot of times people will say, oh, I'm afraid of going under the knife. I'm afraid of anesthesia, all these surface things. The real fearful thing is, what will you feel like 3 years from now, 5 years from now if you're in the same position? And then always flip it. I always like doing both sides of it. But what would you feel like if you had a solution to this now and you had your pre-childbirth body back and you felt even more confident because you had that body back? You have this amazing family. You have all these experiences you've had over the last 10 to 15 years. What would that life look like? Next is, let's do pleasure. She's excited about the idea of enjoying her new body, being able to wear clothes she loves, and feeling a sense of pride when she looks in the mirror. The doctor that I was talking with, she says, like as a joke, she says, it's a very costly surgery because my patients end up going out and buying a whole new wardrobe. And they come in and they say, I haven't worn something like this in 15 years. I couldn't even believe it when I looked in the mirror. I just couldn't stop smiling. And when I was out in public, I kept going to the bathroom to look in the mirror just because of how stunning I looked. And that's what it is. That's the pleasure. Next, wise. I'll flip this one over. Wise. Let's do get more comfort. The combination of these procedures will help her feel more comfortable in her own skin, no longer needing to hide problem areas or feel self-conscious in her clothes. This could be something as simple, and one of the hooks that we recently did, and it was just through a conversation, really wasn't even a conversation, it was an observation of how many outfits do you have that you don't like, but just you wear. And I kind of butchered that, but how many outfits do you own that are really baggy to cover up your body just because you're not comfortable? Or being at the pool, wearing a swimsuit and wearing something over it, and not having a towel over it, and not wanting to show your body off. That is the comfort angle that we talked to in that. Being comfortable in your own skin, being comfortable in any outfit, being comfortable in knowing that you feel good. The thing about all this is it's going to sound like vanity. Vanity's good. Just imagine what the world would be like if everyone was confident in their body, if everyone was happy, if everyone felt good and looked good. What would that world look like? A lot of positivity, and it would be a great world. So that's why all of this is connected. Next, achieve better health. By restoring her body shape, she'll feel healthier mentally and emotionally, allowing her to fully embrace her active lifestyle and enjoy life without being held back by her appearance. I would say, and one thing that I've seen that's come up with this is exercise, diet, healthy lifestyle, but when they're not seeing results, they kind of like defeated it, and it gets to a point like, why do I even bother? You just kind of throw in the towel. You're going to have a healthier, you're going to achieve better health because you're going to see these results and you're going to be more inclined to be more healthy. One thing that we talked about was, and just as a side note on this, one thing that we talked about was her patients actually become more active because they feel better. It's one of these things like they were given, and I hate to say this cliche, but they were given a new lease on life. And the example that I used was completely different, but it was a video of a heart surgeon that I saw where he actually shows the patient their old heart. And he says, I use this as an example of this is a once-in-a-lifetime opportunity that you were given. Really embrace it and enjoy it. So achieving better health is a self-fulfilling prophecy. Through this surgery, through this mommy makeover, they're more inclined to be more active, more inclined to exercise, because it's not like no matter what I do, I'm not seeing these results. They've got the results, and now they're going to maintain it and take care of it. And then lastly, let's do increased popularity. Feeling more confident in her appearance will help her project that self-assurance in social settings, allowing her to engage more comfortably and deepen her connections. If you need help with this, this is the type of writing that I work with my clients. I do the written piece first, and then we convert that into a video. I believe videos are the very best marketing you can do for your practice, bar none, not even close, when you're using this type of copywritten material. So talking to the emotions and whys, would love to help you with that. Would love to have a conversation with you about that, see what type of marketing you've been working on, and do our own writing workshop where we go through some of your top patients that you enjoy helping, top surgeries, treatments, products, whatever it may be, framing it through the emotions and whys, and then creating videos on that. I do short form videos and long form videos with my doctors. The short form videos are going to be more kind of like symptom based. If you're experiencing this, then here's how we can help you. 30 to 60 seconds long for social media. And then the longer form videos are kind of like documentary type pieces, 10, 15, 20 minutes long. Really what it is, it's kind of like a funnel. You're going to grab their attention with the short form video, you're going to take them to a long form video, and that'll ultimately get them to book you a consultation. But hope you found this informative. Would love to work on this with you. Would love to have a conversation about this with you of just how we can create this emotional and why formulas for all of your surgeries, treatments, or products. But give me a call or text me. My cell phone is 310-774-7311. Like I said, get out a piece of paper. Think of who's the patient in the last week, the first name that comes to mind. Write their name at the top, write surgery, treatment, product, whatever you did for them, split it down the middle, emotions, whys, and then list them all out and do it one by one. When you do this, you're creating a story of the patient. And stories, more than any other type of marketing you can do, are going to be the things that really resonate with your patients. So hope you found this informative. Like I said, give me a call or text me, 310-774-7311. Look forward to talking with you, and definitely check out some of my other videos because I go through all this type of stuff, and I think you'll really create unforgettable marketing if you start using these types of formulas because they really work well with my clients. Thanks.